Dr. Amrita, Reader Department of Prosthodontics, Nims Dental College. Today, the topic of my lecture is direct retainers. These are the contents. Retention is that quality inherent in the removable partial denture that resists the vertical forces of dislodgement, for example, the force of gravity, the adhesiveness of foods, or the forces associated with the opening of the jaws. A retainer is defined as any type of the clasp, attachment, device, etc. used for the fixation, stabilization, or retention of prosthesis. Direct retention is the retention obtained in a removable partial denture by the use of attachments or direct retainers to resist the displacement or removal of the partial denture from the abutment teeth in a direction opposite of their insertion. Direct retainer is any unit of removable partial denture that engages an abutment tooth in such a manner as to resist displacement of the prosthesis away from the basal seat tissues by functional means, by engaging a tooth undercut lying cervically to the height of contour, or by mechanical means. According to the GPT, a direct retainer is the component of a removable partial denture used to retain and prevent dislodgement and consisting of a clasp assembly or precision attachment. Factors affecting the retention in removable partial dentures are primary retention, secondary retention. Secondary retention, we have adhesion, cohesion, atmospheric pressure, molding of tissues, and effect of gravity. Coming to the classification of direct retainers, the direct retainers can be classified into two types: extracoronal direct retainers and intracoronal direct retainers. In extracoronal direct retainers, we have manufactured attachment type, flexible clips type, and clasp type retainers. In manufacture, we have examples: Dalbo, spring loaded plungers. Coming to intracoronal direct retainers, these are internal attachments. The examples are cast attached with the tooth structure, prefabricated, frictional resistance. These precision attachments were given by Herman in Chase in 1906. Now coming to extracoronal direct retainers. Extracoronal direct retainers are of two types: suprabulge and infrabulge clasps. Suprabulge clasps are also called as occlusally approaching clasp, Ecker's clasp, Ney type 1 clasp, or cast circumferential clasps. Coming to gingivally approaching clasp, the other name of gingivally approaching clasps is infrabulge clasp or Roach clasp or Ney type 2 clasp. The basic parts of clasp assembly are the rest. We can see here, this is the rest seat. Rest, it is the part of the clasp that lies on the occlusal, lingual, or incisal surface of a tooth and resists tissue-ward movement of the clasp. So we have three types of rest: occlusal, incisal, or lingual. Body of the clasp, it is the part of the clasp that connects the rest and shoulder of the clasp to the minor connector. Shoulder, it is the part of the clasp that connects the body to the clasp terminals. It must lie above the height of contour and provides some stabilization against horizontal displacement of the prosthesis. Reciprocal arm, we have reciprocal arm and retentive arm. Reciprocal arm, it is a rigid in function. A rigid clasp arm placed above the height of contour on the side of the tooth opposing the retentive clasp arm. Retentive clasp arm, it is the part of the clasp comprising the shoulder which is not flexible and is located above the height of the contour. So there is main difference that reciprocal arm is rigid and it is above the height of the contour, and retentive arm is flexible, it will be below the height of the contour. Retentive terminal, it is the terminal end of the retentive clasp arm. It is the only component of the removable partial denture that lies on the tooth surface cervical to the height of the contour. Minor connector. Minor connector, it is that component of the clasp that joins the body of the clasp to the remainder of the framework and must be rigid. Approach arm. Approach arm is the only minor connector which is flexible in nature. All the minor connector, the main requirement is it should be rigid. Approach arm, it is a component of the bar clasp. It is a minor connector that projects from the framework, runs along the mucosa and turns to cross the gingival margin of the abutment to approach the undercut from a gingival direction. Coming to principles of clasp design. First principle is encirclement. There should be more than 180-degree encirclement of the clasp on the tooth surface. More than 180 of greatest circumference of the tooth must be included, passing from diverging axial surface to converging axial surface. This may be in the form of continuous contact. Example is circumferential clasp, or it can be non-continuous. Example is bar clasp. Support. It is a property of the clasp that resists the displacement of the clasp in gingival direction. Primary support units of a clasp are occlusal, lingual or incisal rest. The occlusal rest must be designed so that the cervical movement of the clasp is prevented. Coming to reciprocation. Reciprocation, each retentive terminal should be opposed by a reciprocal arm capable of resisting any orthodontic pressures exerted by the retentive arm. Reciprocal and stabilizing elements must be rigidly connected bilaterally. Always retentive arm should be opposed by a reciprocal arm. So all the forces which are transmitted by the retentive arm are counteracted by the reciprocal arm. This arm is positioned on the opposite side of the tooth from the retentive arm. In addition to reciprocating stress generated against the tooth by the retentive clasp, it is also plays an important role in stabilizing the denture against horizontal movement. This function is very important on support of reciprocal arm. Some cases, additional rest is positioned on the opposite side of the tooth and minor connector will provide the reciprocation. So in some cases, even the additional rest seats will provide some amount of reciprocation. Reciprocal clasp must be rigid. It is tapered as the retentive clasp. Reciprocal arm should be positioned on the surface of the tooth, is regionally parallel to the denture path of insertion and removal, and always the reciprocal arm should be above the height of the contour. If it is placed on the surface that is tapered occlusally, a slight movement of the denture will cause the clasp to lose contact with the tooth and reciprocation and retention is lost. It must be positioned above the height of contact at the junction of the gingival and middle third. The reciprocate forms properly, it should contact the tooth at the same time or before the retentive arm does. So always the reciprocal arm should contact the tooth first or before the retentive arm will contact the tooth. Coming to retention. The path of escapement of each retentive clasp terminal should be other than the parallel to the path of removal of the prosthesis. The amount of retention always should be the minimum necessary to resist reasonable dislodging forces. The retentive clasp is divided into three parts, each with its arm functional requirement. The terminal third is flexible and emerge at the undercut. The middle third has limit degree of flexibility and may engage a minimal amount of undercut. Proximal third or shoulder is rigid and must be above the height of contour. So here we can see that it should be the retentive arm is divided into three parts: terminal third, middle third and proximal third. Proximal third is rigid, middle third is slightly flexible and terminal third is flexible because it will flex around the undercut and will engage the undercut. Coming to stability and bracing. All clasps have reciprocal arm or bracing arm which provides equal amount of stability. All clasp terminals except the retentive clasp terminals contribute to this property of varying degree. For example, cast circumferential clasp great amount of stability because its shoulder is rigid and it aids in stabilization. The wrought wire clasp arm has flexible shoulder. Bar clasp does not have a shoulder, so both provide less stability. So it is very important to note here that cast circumferential clasp you have better stability. Coming to passivity. Passivity. A clasp is placed should be completely passive and the retentive function is activated only when the dislodging forces are applied to the partial denture. Bilateral opposition. Unless guide planes will positively control the path of removal, retentive clasp should be bilateral opposite. Buccal retention on the other or lingual on one side opposed by lingual on the other. In class 2 situation, the third abutment may have either buccal or lingual retention. In class 3, retention may be either bilaterally or diametrically opposed. Now coming to the stress breaking. Stress breaking is a very important criteria in removable partial dentures. Clasp retainers on abutment teeth adjacent to distal extension bases should be designed so that they will avoid direct transmission of tipping forces on abutments. In effect, must act as a stress breakers either by their design or by their construction. This is accomplished by proper location of the retentive terminal or by use of a more flexible arm in relation to rotation of the denture underlying various direct forces. Location of components. The reciprocal element of the clasp assembly should be located at the junction of gingival and middle third of the crowns of an abutment teeth. The terminal end of the retentive arm is placed in the gingival third of the crown. Coming to criteria for clasp selection. The first criteria is survey line location and degree of undercut. These are two most important criteria to select the clasp. First is survey line and other is the degree of undercut. Requirement of retention and stability depending upon whether the upper or lower arch and configuration of edentulous area, axis of rotation and selection of retainers. Coming to survey line. The survey line classification was given by Blatterfin in 1951. He divided the buccal and lingual tooth surface into two halves. He has divided two halves based on the proximity to the distal extension, edentulous space, near zone and far zone. He described four kinds of survey lines: typical survey line, atypical A or diagonal, atypical B or high, atypical C or low. Typical or medium extends from the occlusal gingival midpoint in the near zone to the junction between the occlusal 2/3 and cervical 1/3 in the far zone. Clasp suggested for where such a survey line exists occlusally approaching clasp or gingivally approaching clasp. So in this case, any type, it is a medium type of survey line, or you can give bar clasp or roach clasp. Atypical ace or diagonal. This runs diagonally across the tooth surface from a high position in the near zone to a low position in the far zone. A reverse action or hairpin clasp is recommended. Gingivally approaching clasp may also be used in this case. Atypical B or high survey line. This type of survey line is parallel to the occlusal surface and lies close to it. A wrought wire clasp approaching arm may be used if accompanied by a low survey line on the opposite side of the tooth. A ring clasp or back action or reverse back action have been recommended. So in this case, you can see that the survey line is too high. When the survey line is too high, the depth of the undercut is more. When the depth of the undercut is more, you need more flexible clasp arm. So you can use wrought wire clasp arm. Atypical C or low survey line. The low survey line is parallel to occlusal surface but has just above the level of the gingival margin. In this type of survey line, the extended clasp is recommended. Undercut may develop by recontouring the tooth surface. In this case, the survey line is towards the gingival third of the tooth. According to Ney, he has classified the survey lines into class 1. Class 1 survey line runs diagonally across the tooth surface from a low position on the side of a rest to a high position on the other side of the proximal side. Class 2, similar to Blatterfin atypical A or diagonal survey line, here the gingival approaching clasp is recommended. Class 3, it is the same as the Blatterfin atypical B or high survey line. Selection of clasp based on requirement of retention and stability. A large number of edentulous area are more and more bilaterally placed. The selection of a clasp depends upon the other criteria such as degree of undercut, abutment and the type of alloy used. Cast circumferential clasp properly designed shows greater retentive and bracing properties than a bar clasp used in a similar situation. Support. Selection based on the nature of support, whether the tooth or tooth and tissue bond and length of the edentulous span. In case of long span clasp situation, preservation of abutment teeth is important, where a RPA clasp is used to prevent the torque on the abutment teeth. Root size and form of the tooth. Clinical conditions of supporting structures, that is alveolar bone and periodontal ligament, should be considered. Abutment teeth with short conical roots, bone loss and periodontal ligament mild periodontal problem may not be able to withstand lateral forces. That कितना टाइम हुआ? ठीक है, ये कट नहीं हो जाएगा, फिर से करना पड़ेगा. ठीक.
कितनी देर का रहा?
अभी 5 मिनट का हो रहा है. कितने मिनट का हो गया?
आपका 16 मिनट का हो गया.
ठीक.
जरूर थोड़ी 20 मिनट कंप्लीट करना है. कोई टाइम डाउन लेना आपका टॉपिक कंप्लीट करो.
हाँ, ठीक है. Oral hygiene and caries. Maintaining oral hygiene is prerequisite to treatment with cast partial denture. High caries index contraindicate the use of clasp with an unprotected tooth surface as with a ring clasp. Bar clasp has minimum tooth structure contact and less interference with the natural cleansing action. Coming to aesthetics now. Aesthetics. Gingivally approaching clasps are generally preferred for aesthetic reason but may be more unaesthetic than occlusally approaching clasp if the patient has a high lip line or exposes the excessive gingiva. Presence of excessive tissue undercut. Gingivally approaching clasp is contraindicated in presence of excessive tissue undercuts. Coming to factors of retention of a clasp. Size of the angle of the cervical convergence. Guiding planes determine the path of the placement and removal of a partial denture. Therefore, without the use of guide planes, clasp retention will either be detrimental or practically non-existent. Degree of undercut. Relative uniformity of retention will be depend on the location of a retentive part of the clasp arm, which is not in relation to the height of the contour, but in relation to the angle of the convergence. Retentive clasp arm must be located so that they lie in the same approximate degree of undercut and on each abutment tooth, despite the variation in the distance below the height of the contour. Flexibility of clasp arm. The length of the clasp arm. As the length is more, the flexibility of the clasp arm will increase. A cobalt chromium clasp engages the same degree of undercut will have different flexibility and resistance to distortion than the other metal clasps. In this diagram, we can see the circumferential clasp and bar clasp and the flexibility of the various clasps. Diameter of the clasp. As the diameter increases, the flexibility will decrease. So, diameter is inversely proportional to the clasp flexibility. Cross-sectional form. Half round clasp will be less flexible than the full round clasps. Material used for the type of clasp. Type for gold alloys and cobalt chrome alloys which have different modulus of elasticity. The modulus of elasticity of cobalt chrome alloys is greater than that of cast golds which have a higher modulus than wrought wire clasps. The retentive terminal has to be flexible and thereof have low modulus of elasticity. The reciprocal elements have to be stiff and unyielding and have a high modulus of elasticity. Therefore, a clasp of the same cross section is stiffer in cobalt chromium than in cast gold. Cast gold clasp will be softer or flexible, more flexible than the cobalt chromium clasps. Structure of alloy. The alloy must be cast or wrought in nature. Wrought wires have greater flexibility than a cast structure due to its grain structure being fibrous. The tensile strength of a wrought structure is least 29 degree greater than the cast alloy from which it is made. Wrought wire forms can be used in similar diameters to enhance the flexibility. Support. Support is a property of the clasp which enables to resist displacement in gingival direction. Primary support is obtained by the occlusal or incisal rest. So, primary support is determined in CPD by the rest seats. Stabilization or bracing. It is the resistance which the clasp contributes to the displacement of the prosthesis in a horizontal plane. Stabilization and bracing is mainly provided by the reciprocal arm. Reciprocation. Reciprocation may be defined as the means by which one part of the prosthesis is made to counter the effect of created by the another part. For effective reciprocation, clasp should be planned and designed so that two arms of the clasp are balanced. In this diagram, we can say that the reciprocal arm, this is the retentive arm, and both sides, retentive arm and reciprocal arm, the forces of the two sides will be balanced on the tooth structure.